Lyme disease is a serious infection. It's caused by bacteria. These bacteria spread through tick bites. The ticks that carry Lyme disease are small. They're often found in grassy or wooded areas. Lyme disease is most common in the United States and Europe. If you get Lyme disease, it's important to get treated quickly. Early treatment can prevent long-term health problems. Lyme disease can affect different parts of the body. This includes your joints, heart, and nervous system. Lyme disease is a growing concern. More and more people are getting it every year. It's important to be aware of the risks. Knowing the symptoms can help you get early treatment. Early diagnosis is key. With prompt treatment, you can recover fully from Lyme disease. Lyme disease is caused by bacteria called Borrelia burgdorferi. In the United States, the bacteria Borrelia myonii can also cause Lyme disease. Black-legged ticks carry these bacteria. These ticks are tiny, about the size of a poppy seed. The ticks get infected when they feed on small animals. Mice and other rodents often carry the bacteria. When an infected tick bites a human, the bacteria can enter the bloodstream. The longer the tick is attached, the higher the risk of infection. It usually takes at least 36 hours for an infected tick to transmit Lyme disease. This is why it's so important to check for ticks regularly. Ticks can't fly or jump. They latch onto you when you brush against them. Always check for ticks after spending time outdoors, especially in grassy or wooded areas. Lyme disease symptoms can vary from person to person. They often mimic other illnesses, making diagnosis tricky. The disease progresses through stages, each with its own set of symptoms. The first stage is called early localized Lyme disease. This stage typically starts within a few days or weeks after a tick bite. The telltale sign is a red circular rash called erythema migrans, or EM. This rash often looks like a bullseye. However, not everyone with Lyme disease develops this rash. Other early symptoms can include fever, chills, headache, fatigue, muscle aches, and swollen lymph nodes. These symptoms are common to many illnesses, making Lyme disease difficult to diagnose based on symptoms alone. If Lyme disease is not treated early, it can progress to the second stage, known as early disseminated Lyme disease. In this stage, the bacteria begin to spread throughout the body. Section 4. Diagnosing and treating Lyme disease. Diagnosing Lyme disease can be challenging. Early symptoms are often non-specific and can mimic other conditions. Doctors rely on a combination of factors to make a diagnosis. First, they'll ask about your medical history, including any recent tick bites or exposure to ticks. They'll also inquire about your symptoms and conduct a physical examination. Blood tests are used to confirm the diagnosis. The Centers for Disease Control and Prevention, or CDC, recommends a two-tiered testing process for Lyme disease. This involves an initial screening test followed by a more specific confirmatory test if the screening test is positive. Early diagnosis is crucial for successful treatment. Antibiotics are the primary treatment for Lyme disease. They're most effective when given in the early stages of the disease. The type of antibiotic and duration of treatment will depend on the stage of the disease and your overall health. Most people with early Lyme disease make a full recovery with appropriate antibiotic treatment. Section 5. Preventing Lyme disease. Essential precautions. Preventing Lyme disease is crucial. Simple precautions can significantly reduce your risk of getting bitten by infected ticks. Avoid tick-infested areas whenever possible. Ticks thrive in wooded, grassy, and leafy environments. When venturing outdoors, wear protective clothing. Opt for light-colored clothing as it makes it easier to spot ticks. Tuck your pants into your socks to create a barrier. Use insect repellents containing DEET or permethrin on exposed skin and clothing. Permethrin-treated clothing is highly effective at repelling ticks. However, it's important to note that permethrin is toxic to cats. After spending time outdoors, perform a thorough tick check on yourself, your children, and your pets. Pay close attention to areas where ticks like to hide, such as the scalp, behind the ears, under the arms, and in the groin area. If you find an attached tick, remove it promptly and carefully. Use fine-tipped tweezers to grasp the tick as close to the skin's surface as possible. Pull upward with steady, even pressure.